And we are on. Hey, Facebook family and friends. We are so happy to be here with you all today. We have another great lineup in the studio. I'm going to have some of my good friends and some folks who I just became friends with recently, but it's because we're doing such great work together. So we're happy to be here with you all on this Thursday evening. You got one more day till Friday, and then you can, kind of kick your feet up and maybe relax just a tad bit. So we have a wonderful show for you. We had a great show a week or two ago where we had young people. Was it young people in the room? Was it young people that we had? No, we had women. We had the women in the room.
Yes.
I'm glad I'm not the only old one up in here that can't remember stuff. So we had women in the room, and they were talking about, what's it like being single in the 21st century? That was a great conversation. If you missed it, go back, catch it from last week, and be prepared for the next conversation that we will have. The week before that, we had some young people in the room. They showed us a little bit of their talent. It was amazing. So watch that one as well if you haven't done so. But for today, we have a great show in store for you. Before we go any further, I want to say thank you to George and James Out of the Mud Inc. for always opening up this beautiful space to allow us to have these wonderful conversations. So right now, before the conversation jumps off, I want you to tag some people, invite them in. We're going to be talking about some really good stuff today that all of us can benefit from. If you don't want to tag anybody right now, after the show is over, please tag some people, share the video, because it's going to be some really good nuggets shared here today. And I want it to be able to encourage some folks who might be struggling right now, might be going through it, might just need a little pick-me-upper. Let's put it like that. So the topic for today is when life throws you a curveball, you bounce back. When life throws you a curveball, y'all can talk to me. It's quiet. Shoot, I'm like, when life throws you a curveball, you bounce back. You don't stay down. You don't, it don't defeat you. That curveball is not going to defeat you. But when life throws you a curveball, you do not stay down. You get up. Look, I feel like I'm in church. Do I got a witness? Yes. You do not stay down. You get up. And I know life has thrown many of us a curveball. I know there's some of you on Facebook right now, Twitter, Instagram. Life has thrown you a curveball. And I'm hoping that this segment here is going to lift you up. Or maybe you already have pushed through. And if you have pushed through, keep on pushing. Keep on striving. Keep on pressing towards the high mark. Don't stop. Keep on going. So when life throws you a curveball, you bounce back. So speaking of bounce back, listen, they told me, I had to write it down. They told me that today this is not a Wildcat party, y'all. So all the Wildcats in the room, all the Wildcats is on Facebook, that's on Twitter, that's on Instagram. Listen, I need you to chime in right about now. Throw them up. Wildcats.
They should have been an Indian.
No.
It's the Indian takeover today. Indians taking over today.
No. And we got some, what was y'all?
What was y'all?
Right, we don't even know what was y'all.
I don't do some wrestling like that. It's the night.
Yeah, so we have some knights in the house as well. Okay, but Northwestern is where it is. So, class of 1989, I hosted y'all at my house the other day. So y'all better chime in, say something, make us known. So, I'm gonna simply introduce the people that's here, but I'm gonna give them time. We have time for them to introduce themselves. I want them to share with you who they are, a little bit about what they're doing, and then we'll just go on to the next person. Okay. So the first person, I'm right-handed. So I'm going to start with Tamika. Tamika is a person, she goes to our Church Without Walls, Pastor Martez Warren, Lady Natasha Warren. Shout out to y'all. Yes. To the whole CWOW family. And she's also a nurse. She's a nurse. She's a mom. She is such a hard worker. I mean, within her home, within her community, for the business, for those who are in need. The list goes on. I said your mother, right? Yeah, she's an active mom. She supports her baby wholeheartedly. And then she finds time to develop businesses and and do her nursing thing at the same time. So she's going to have some time to share more about who she is. Then I'm going to go on to Syveeta Powell. Syveeta is also a mom. She just started a business. I'm not going to name it. I'm going to let her share that information. But she just started a business. Man, this lady, she do not give up. Talk about a dog with a bone. She is not going to let it go. So she's a great person to have in your life, to have as a part of your family, and to just be connected to in community. The next person I'll introduce is Dr. Latressa Grodon. And Dr. Latressa, listen, we don't know each other personally, but what I do know is she's an amazing woman. She helps out where she can. And although, being a doctor, and she gave me the doctor nurse in practice, and her focus is public health. When you're doing something like that, you already know it's a heavy lift. You're doing a whole lot, but she always has time for women, for children, for our community, and I just appreciate her for that. Y'all see, she's here right now at 6:20 in the evening, and she got off the highway from Saginaw from another podcast. So that's just what we do. And lastly is Schnell Reaves. Chanel and I have been friends for over 20 years.
Almost 30.
Yes, we've been friends. Girl, I didn't go there on purpose. Chanel and I have been friends for over 20 years. She is an amazing woman, amazing mother, and she gives back. When you can confide in Chanel for just about anything, and I appreciate her so much for being in my life. And when you hear about when life throws you a curveball, when you hear the stories of some of these women that are in the studio today, you're going to be like, man, how can they be a mom? How can they give back to community? How can they be available for other folks when they got so much stuff going on themselves? Well, that's what we want to talk about today. That's exactly what we want to talk about today. So without further ado, I want to turn it over to these ladies and let them introduce themselves, and whoever want to jump in first and just do a brief introduction of who you are and let us inside a little bit.
So everybody
is looking at you. Everybody was looking at you.
Everybody was looking at me, so I guess I'm starting. Okay, my name is Syveeta. Like she said, I am a mom. I did just currently start a business. It's called Rolling With You. It's a personal assisting business. So I am in my startup phase. So I do some work, but I'm still developing. I have 2 amazing children who irk my nerves, but I love them to life.
On some level.
But yeah, I'm here today, ready to tell my story.
Nice, thank you. Rolling with you.
Rolling with you.
Rolling. All right.
That's what I do.
All right, who's next?
Hi, I'm Latressa, or Doc G as I'm known in the community. I am a mother of 4, a grandmother of 5. I'm a U.S. Army veteran. I've been in nursing long as I've been alive, about 35 years. Close to it.
Okay.
Anyway, but I love working with the community. I love giving. I love, helping, like she said, wherever I can. And just, I'm just here to, tell. I've been knocked down multiple times, and by God's grace, I'm still standing. Like I say, I always call myself like a weeble wobble. You get knocked down, that's aging you too, but you don't fall down. Knocked down, but don't fall down.
I love that.
Yeah.
Thank you. And I know y'all gonna introduce yourself, but I appreciate you saying that about the knockdown, because a lot of times people look at us outside looking in, and they be like, "Oh, you know what? They're good. they're fine. They don't understand what I'm going through because they got it all together." But only if they knew. Only if they knew just an inkling of what you've gone through. And to hear, Dr. Latressa Grodon's like, "Oh, she's a doctor. Yeah, she don't understand anything that I'm going through." So I appreciate your transparency in that, to say that, yeah, there has been times where, where this has happened to me, but I refuse to stay in that situation. Thank you.
Your turn. Okay. I am Tamika Lang. I have 2 sons. I've been a nurse for 11 years. My specialty is nursing education. I own Soaring CNA Training Center, the top medical training company in Genesee County.
Okay.
And I am co-owner of Divine Needs Enterprise, where we own an assisted living facility as well as a child care. So yeah, it's a little bit.
And my name is Schnell Reaves. I am the mother of 2 adult children. Mine are grown. And then I'm an aunt, or they call me TT, 7 nieces, and now a great nephew. Very family oriented. Let's see. I guess that's about it for me. I don't have a whole lot of accomplishments there.
No,
That's a lot of accomplishments.
being a mom is an accomplishment in
all
and
in
of
itself.
itself.
That's
Yes.
a promotion. Yeah.
Yes. So again, thank you. Thank you for taking the time out of your, Thursday evening to spend with me and all of our viewers here. We really appreciate you all. So just thinking about how when life throws you a curveball, when receiving certain diagnoses, when you're living paycheck to paycheck, when you're just depressed, you don't know like which way to go. You got people in your life who is saying things to you that you really don't think is true. But you know what? I'm starting to second guess myself because so many people have been telling me for so long that I'm not something, or who, like how bad I am, how worthless I am, how unappreciative they might be of who I am and what I'm trying to give, that I'm starting to think those things about myself also. And so when we think about that, it's like life just throws you this curveball. You're going through your life and everything is cool, to a certain extent. You're managing anyway. You might still have some bad people, places, and spaces in your life, but you're managing. And then all of a sudden, bam, this curveball just hit you out of nowhere, completely out of nowhere. It's like, how do we function in that? From a mind place, from a physical place, how do we do that? And so I guess I'll start off with you, Syveeta. If you can tell us a little bit about your curveball experience.
So back in 2022, I was healthy all my life. And back in 2022, yes, it was 2022. The curveball, usually people say is the diagnosis. My curveball, it came before the diagnosis, because prior to being sick, I was healthy and I was in and out of the hospital like every 2 weeks, faithfully in there. And then I would be in there for a week. And finally, 5 months later, I was diagnosed with Hodgkin's lymphoma. So my diagnosis
What is that? I'm sorry.
Hodgkin's lymphoma, it's a blood disorder. It's a blood cancer. Mm-hmm. So like for me, my blood cells were essentially like eating themselves. So like I stayed anemic. So I had to have blood transfusions frequently. So I had a lot of precursor things that happened before my diagnosis. And one of the things that they did was they put me on steroids, and my steroids caused other things to happen. So when I say my diagnosis was like a woosah moment for me, because it was like, oh, finally, now we can stop treating the symptoms and actually treat the problem.
What does that look like, treating, and maybe Dr. Latressa or Tamika, treating the symptoms? Because I think all of us can say that we've had a curveball experience. And if you've had a curveball experience and you're online, please let us know. Put it in on the screen so that we can see it. But oftentimes we go to our doctor, or even before we go to the doctor, we feel like something is wrong within our body. And we might go to the doctor and tell them what we're experiencing. I don't know if anybody else this ever
They brush you off.
They brush you off. They don't find anything.
They pop you with Motrin 800s to get rid of one problem, but it's causing another.
Yes, give you medication.
Medical gaslighting.
Yes. So, and I want y'all to jump in, but you have to be your strongest advocate, even if it's to a doctor. You have to continue to be persistent about what you're feeling, what you want for yourself, and how you want to move forward. So as Syveeta finishes, I just want to know, do y'all have anything to add to that?
You said pretty much it's your advocate in health, like health literacy. So basically knowing about your condition, knowing the signs and symptoms, knowing the treatments, and working with your physician to come up with a plan that works with for you. So it's not just like the doctor's in the driver's seat. You're both in the seat together. So yeah, that's one of the things too, that you're not helpless when you get a diagnosis. You don't just have to go with the flow. You can ask questions and get explanations. And then if it's not working for you, what else can we do? So just taking that charge at you.
I got sick the end of 2000. Thought it was just a really, really bad case of the flu or something. And January 26th of 2001, I finally went to the doctor again. And they told me I was in end-stage renal disease. I had to go emergency right away. They began dialysis, and I have been on dialysis now for 24 years. And I thought it was a death sentence automatically because I never had any health issues. I didn't know what was going on with me. I knew something was wrong, but every time I went to the doctor, they're brushing me off. Like you said, advocating for yourself. They made me feel like something was wrong with me mentally because I had all these different things going on. I kept telling them, I was like, I'm at work. I'm taking my blood pressure while I'm at work. It's high. But when I go to the doctor, they say, oh, no, your blood pressure is normal. No, I'm getting migraine headaches, nosebleeds, back pain. All this other stuff was going on. And so finally, after beginning dialysis, I think I coded the first treatment.
Oh, my goodness.
And my boss at the time, which is now, he's also a pastor. Not gonna say his name.
I was gonna say, is that a good
Not
thing?
gonna say his name, but he was there. He was there when I coded.
Okay.
So when I woke up and came out of it, him and his wife was right there. And at that point, I knew it was just a blessing. He was supposed to be there at that time. Man, that was something. It was Andre Powell. That's his name.
Okay, I know that pastor.
Yep. He was my boss at the time, and took about 6 months. I think I wasn't able to work for 6 months. Then I went back, and I had a hard time because I was working third shift as a security officer, and it was just too difficult. And at that time, my kids were little, so I had Marcus was 10 or close to being 10, and my daughter was 4, going on 5, and it was just hard. And in that whole month, I had to live in the hospital. I was living at Genesis Hospital for a month. Without my kids, and I had never been away from them, never. And it was very painful, but I did it. They gave me some cancer medication. They didn't know what caused my kidneys to fail in the first place. It ended up being rapidly progressive immune complex glomerulonephritis is what they ended up diagnosing it as. Then in 2018, I was diagnosed with lupus. I was diagnosed with congestive heart failure. What else did they say? Osteoporosis, osteoarthritis. I have Hashimoto's disease. I mean, because once you get an autoimmune disease, it's like a very low acting thyroid disease. And I think it's prevalent with women. But once you get an autoimmune disease, you're susceptible to more.
Wow.
So it's just one thing after another. But I keep going. Like I said, caring for my nieces and watching them all grow up and being their child care provider all these years. It's been a blessing to me. It's what keeps me going.
So what happens when you get a doctor that doesn't listen to your voice, that continues to try to put on you their what they think is best, and is not aligning with how you feel? What happens in that situation? Because some people just feel kind of hopeless in that.
So I always say, if you put a shoe on and it's squeezing your foot real, real tight, you're going to take it off and change those shoes. So if you're going into, if it's not a good fit for you, your physician might not be a good fit. Physician might not be a good fit for you. So it's all, you can change the physician. I know sometimes we have our healthcare plans. It's a little difficult, but you're not stuck with that physician. But a lot of times, even myself, when you go in there, and I've gone in and had something done in the office, and my daughter, she's like a radiologist, she's a physician, and I said, they did such to me. She said, well, why in the world would you let them do that to you in the office? I said, I don't know what I was, and I know, but you freeze and you just kind of go with the flow because they're supposed to know, or you don't want to ask questions, but it's gone on those days. Those days are gone. Today is the day, like you say, advocate for yourself, ask questions. And I've worked in the hospital, like I say, for 34 years, and I've seen so many patients save their own lives by seeing a nurse come in there with a pill and say, well, we're giving you this today. And they're like, I don't take that kind of medication. I'm not diabetic.
Mm-hmm.
And then it's like, and I've seen them, not me, of course, but I've seen them pause, and then they'll go, well, I'll be right back and look. And like, oh, you're right. You don't take that. So speak up. So if they're bringing you something that you don't take, ask, or a new medication, what type of medication? What is this medication for? If it's not your condition, okay, let me speak to the doctor. If you're not comfortable, it's supposed to be a two-way communication. And we're working on that, that health literacy piece and that communication where physicians and the patient, we're working together. You're just not there. They don't tell you, like, they're not over you. They're not in charge of you. They're, they have an expertise, but they're supposed to listen to you. You know your body. You live in it day in and day out.
Thank you for that.
It's very important.
Yeah.
Very important to ask questions, because if you don't ask questions, like she said, you will get some of the worst treatment, and you can end up taking something that could end your life. Ask questions, advocate.
So to hear that Syveeta was diagnosed with a form of blood cancer, is that correct?
Yes.
And Schnell was diagnosed with renal.
It's renal disease at first, and then it became a renal disease on top of a bunch of other things.
So I think that's why it's important, and I'm saying this to our viewers, it's so important to not judge a book by its cover. Yes, these women look good on the outside. We all look good on the outside, but you don't know what people are experiencing on the inside. That's why it's so important to always be kind, to always exhibit love, to always lend a helping hand to the best of your ability. Don't judge a person simply by what you see on the outside. This lady here has been on dialysis for 24 years. 24 years. Yes. So if you're having a bad day and you just walk past her, or you say
they
something.
Wouldn't know. Nobody knows.
That's the point. That is the point.
Nobody knows.
That is the point. That's why it's so important for us to always, carry the spirit of God. To always be kind, because you don't know how she's feeling on a particular day, or Syveeta, or any of us. Based on what you say, based on how you treat me, guess what? It could be the final straw in me deciding that I want to live, that I don't want to live, or that I want to go hurt somebody else. So, it's just so important for us to always exhibit the love of God and just be as kind as we possibly can be, and not judge a book by its cover, because you don't know when that curveball, you don't know what that curveball experience was, and you don't know when yours is coming around.
Sure.
And as you spoke, you don't know what people are going through. A lot of times you have unseen conditions. It might be like I suffer from PTSD. I'm a veteran. So a lot, it's a stigma attached to mental health. And so that's one of the things I want to break the size and break that stigma, because you people like, what? Yes, I have anxiety. I have panic attacks. I have PTSD from the military. But like I say, that curveball came to me. I keep picked by the grace of God. He keeps holding me up and picking me up and continuing forward. But so you just never know what people are going through physically or mentally.
So true. And Chanel, I don't know your story, and then Dr. Latressa and Nurse Tamika, I'm sure you all may have a curveball experience that you want to share. But Syveeta, I know you're not even supposed to be here this year. Like, in this moment, you're not even supposed to be here, because last year, the diagnosis and the conversations they had, it wasn't looking like you would even be here.
So last year at this time, I was like 2 months post stem cell, bone marrow stem cell transplant. And that in and of itself was a lot. Like Chanel said, she was in the hospital for a month. They was going to have me in the hospital for a month, but I was determined. My son's birthday was November 30th. I was determined to be home by his birthday. And so I went home on the 29th. But those 3 weeks, I was in the hospital for 3 weeks, and it was probably the hardest 3 weeks of my life, because they gave me a whole week of chemotherapy, Some of those days I had it twice a day. And I think that was probably the time when I just wanted to sleep. That's all I wanted to do. And every day my mom would call me and be like, hey, you don't have to talk long, but you got to talk to your kids. And so I didn't just have my mom. My little sister was calling me, V. I was like, I don't really want to talk right now. She was like, I don't care. She was like, you're going to FaceTime me. You're going to open your eyes and let me see your face. And so in that helped me fight through it. But, you know, it was hard. Like last year, like I got hair, y'all.
Oh my
Last year at
goodness.
this time, I didn't have any hair. Like my hair I was slick. So now it's about that long now. So like I got braids. I ain't had no eyebrows. I didn't have no eyelashes. Like the way my skin looks now is so much better than what it was. Like I think I showed Kenyatta a picture of what I looked like at this time last year, and she was like, wow, thanks for sharing that, because I told her it was actually the time that I've never felt ugly in my life. Like I had never felt ugly, but when I was in that moment, I didn't care about being ugly because I was like, I'm still here. So if I gotta go through the rest of this life ugly, then I'm gonna go through the rest of this life looking just like this.
Wow.
But by the grace of God, I'm here.
As beautiful as ever.
Thank you. That was a hit. He brought me back.
Wow. So, Dr. Latressa, Nurse Tamika, have you all ever had a curveball experience?
I have. So I have celiac disease. But I had went to as a nurse. Okay, so celiac is
They throwing out all these big words, y'all.
It's also an immune disorder. And it's of the digestive tract. It's an allergy to wheat. So I would often go to and I'm really funny. I was in the hospital. I would always like joke with my doctors and stuff. And I would always joke with the GI doctor and tell him my stomach hurt. Every time I ate, my stomach would hurt and it would bloat out. And I would go wide. Like I didn't know what was going on. So I kept telling them, ended up getting a colonoscopy. It didn't really show anything. And I said, something's still not right. It's not normal to eat and your stomach hurts. It's not normal. So I told them, because I would diagnose myself with everything basically. So I said, I don't think my gallbladder works. So I went to imaging, and as the person was doing the image of my stomach, she said, does that hurt really bad? I said, yes. She said, I thought so. My gallbladder was working at 0%.
Oh my God.
Okay. So they took it out. My stomach still hurt. And I went to the doctor again, to my primary. And at the time they sent in, my primary was out. So I had a visit with a nurse practitioner. She was new to the office, so she didn't know I was a nurse. And I never tell people I'm a nurse unless you ask what I do.
That's what you do.
So I let you treat me how you're going to treat me.
All right.
So I went in, and the first thing she said was, you're here always because your stomach hurts. Never have I asked for pain medicine because I don't like taking medicine. So she said, you're always here because your stomach hurts. I said, I am. And I had my gallbladder out, and this was going on, and this is going on. I said, so I want you to test me for celiac disease. You don't have celiac disease. I want you to test me for celiac disease. She said, well, I'm going to run a bunch of other blood tests as well, like for diabetes and things like that. I said, okay, that's fine. Make sure the celiac panel is on it with a smile. Thank you. That was 4 years ago. Do you know, to this day, she never called me back and told me that my results were positive. I had my results always come to my phone. To this day, nobody ever called me and told me.
God.
I looked it up myself. I looked at my own results and saw it. Yep.
So no treatment or anything from them?
Nope. No treatment for it. Manage it on my own. But honestly, because I'm a very honest person, sometimes I manage it and then sometimes I don't. And it's just a lack of discipline. It's a mindset. But after hearing you ladies talk, and especially you, you have to have discipline. It's not an option.
I know.
So to be able to, like, a lot of times we take things for granted, such as me eating pizza on my way here. I'm not supposed to have it, right?
hungry.
get
I'm
the
not
cauliflower
either. But
crust.
I
It
take
tastes so
binders
good.
with
Oh my
mine, so I can
God.
have
So
it.
it's okay. Yeah. And there are healthier alternatives or similar alternatives. But just hearing you ladies talk and seeing like a lot of the things we take for granted, someday I might not be able to just say, oh, I'm gonna have a slice of pizza on my way here.
Wow.
So learning from you guys, I was supposed to come and teach, but learning from you guys to be disciplined now before it's too late and then I have to, or it'll be a huge flare up. So
Wow.
You know?
Thank you. Thank you for your honesty and your openness to
yes.
share that.
My curveball was last year. I had, I'm not gonna say what happened, but I had a procedure at a doctor's office, and I woke up the next morning and I couldn't move my left shoulder. So immediately I thought I had a stroke, but I had an allergic reaction. I have allergies. That's my thing. So my hands were swollen. So all last year, I had a frozen shoulder, which is painful. And I still don't have my full mobility. And then once they did the shoulder surgery, so this is like one of those, as many are the affliction of the righteous, but the Lord delivered you from every one of them. I had the shoulder surgery. Then the next day after surgery, from the medication, I fell and I tore my meniscus. So I had my right arm, left shoulder down, and my right knee down. And then I had like 3 major surgeries last year. So that was kind of a mental, like a torment with like not being, like say we're getting older, but physically not to be. I'm a strong person, like to work out, not be able to do what you're normally able to do. It messes with your, mental. And then of course, like, I'll be at the store. I'm on this way, limp this way. Somebody let me help. No, I don't need any help. So, they're like, okay. And so they're like, what is wrong with you? I don't need any help. So basically, it's like, ego and pride, but I needed help. So, but yeah, so that was very, eye opener, because, you can be normal one day, well, not normal, moving everything, and wake up the next day and it's gone. So just not taking anything, for granted, and just like, yeah, that was a painful experience.
Yeah, so that so when you say I don't need any help, checking on your strong friends,
Yes,
making your strong friends do the things they they need to do is so very important. Because those of us who are strong, we just want to keep on keeping on. It's like, no, stop.
I have a son that keeps telling me to sit down, Mama, sit down.
Right.
That's what I tell you. My daughter, because I got up and I fell again, and it was like, would you sit down?
Just
So
have a
the
seat.
kids is parent and the mom.
As little as mine, they be doing me too. Mom, you okay? Why don't you just sit down? You busy? Okay, just sit down.
That is so
I get
funny. So all of you have mentioned the mind. That is the mindset, that your mind have to be right. It's a mental. It's heavy on your mental. Like when your body goes out, when you're having things happening inside your body that you don't know what's going on, it affects your mental, your mind. And I want Tamika to talk a little bit about a presentation that I witnessed her do about a week ago, and it was amazing. She gave me some nuggets to chew on. My life is definitely improved from last week to this week because of some of the things she shared. And also my brother, who's Pastor Warren, he also shared some things that totally touched me. He said sometimes we have to challenge our thoughts because our thoughts will make us think some stuff and it makes us feel worse. So we have to challenge our thoughts. And one thing that he said is, when my mind says something to me that I really don't believe in my heart, I have to tell my mind to prove it. That's powerful, y'all. I have to tell my mind I need to look at the viewers on this. I have to tell my mind to prove it to me. So if my mind say I'm worthless, if my mind say my body can't do this, you can't get up and walk to that door. If my mind said I can't be happy today, I need to tell my mind, then prove it to me. Make me believe that. And if my mind can't prove, which more than likely it won't, then I need to get up and try to do the things that I'm supposed to do. I need to push myself. I need to get up out of the darkness. I need to open up some blinds. I need to go outside and smell the roses and the fresh air and all these types of things. I need to go to the grocery store. And guess what? You might not be able to walk too far into the grocery store. And if you got to ride on one of those carts, then so what? Listen, just do it. Just do it. But don't be a prisoner in your own home because you're embarrassed to get out and walk, or how you walk, or that you can't walk and you got to get in the cart. Listen, just do the things that you know you need to do. So he said, challenge your thoughts. Have positive self-talk. Does anybody know what positive self-talk is?
I can do this.
Give me an example. Yes.
I can do this. I got it. I got this.
You remember when Bob Boucher won the Super Bowl, do you? It's from the Water Boy, but he said, "You remember Bob Boucher won the Super Bowl, do you?" I'm just silly, and I have to make myself. I was actually driving and had to pick myself up in a snowstorm, and I had to go back. I'm like, I wanted to cry because I'm like, oh, I can't do this. But and some said, remember when you drove to Chicago and the blizzard take your son to a football game? So I just saw a comedian one day was say, remember Bob Boucher, just remind yourself, remember the good things that you did,
Right.
things that you still got it, you still can do it. So that's just one of my little references that I use humor a lot to cope with things. Yeah.
Yes. Chanel, positive self-talk. Come on, you got it. Come on,
I
y'all.
talk
Cheer
to
up.
myself all the time. I don't know if it's always good.
So one positive self-talk that you, if you haven't said it, you're going to start saying it going forward. One positive self-talk.
Good.
Yes.
I'm good.
Wait. Say it 3 more times for the ones in the room.
I'm good.
Yes. That's it. That's good. Positive self-talk.
She actually took mine. I was gonna say I'm okay, but I'm doing my best.
All right.
Yeah, we do our best every day.
I
Doing my
love
best.
that. I love that. Okay. He also said, check unrealistic thinking. Check unrealistic thinking. So many of us have been through a lot, some more than others, but our mind is going to make us think some things that's unrealistic. Like you can't make it. You won't make it.
I have a lot of negative thoughts a lot of times. I do suffer from depression and anxiety. I'm on medication for all those things, but still it's a daily, it's a fight every day to keep those bad negative thoughts out my mind. A lot has to do with how I grew up or, in my situation of just my life in general. It's not been easy.
Right.
This life is not easy. It has not been easy at all. But again, I'm good. I'm still here. I take medication. I pray when I need to pray, which is a daily thing. My kids, they call me every day, check on me and things like that. Because this is just something I deal with, and I've called on you a few times. Yeah, it gets hard. Life gets really hard.
But you got this.
I know.
And you got some strong women around you. I mean, I don't believe in coincidences. I believe that
You were brought in my life for a reason. You know that.
Oh, thank you.
Church Without Walls. I've been there, visited a few times. I think I tried to join at one point in time.
What? How you try to join? I don't even understand it. How was it try to join?
I didn't take the classes. I didn't go through what I should have gone through.
You can always come back.
Oh yeah.
The
door is always
I
open.
never went to the
I
classes.
I
I've been there
know.
for years. So. Right.
Pastor, you hear that? Pastor is online.
He's my favorite person.
He knows me. We know each other well.
Your seat is still there too. It is Pastor. I think is that Pastor Powell?
Probably.
He said, "Go, Ma." So yeah. So yes. You got to check those. In therapy, we call it stinking thinking. You got to check that bad way of thinking, that negative thinking. You got to check that, put it in its place, and tell you have no place in my mind, in my body, in my soul. So you just got to let it go. You're still here, and you're here. All of us, we're here for a reason. Let's not just exist. Right. You know what I'm saying? Let's not just exist. But since God kept you here, let's do something about it. You know what I'm saying? Yeah. And one other thing that Pastor said is we have to watch for the distraction, and we have to watch for the distractor. So sometimes our illnesses is a distraction to take us off our mark, to take us away from our assignment, our purpose, and things like that. Because sometimes our body hurts so bad that you just don't want to get up and go. But what can you do? You know what I'm saying? You might can't do the things that you really want to do, but what can you do? Can you get up and make a call? Can you write in your journal? Can you send a text to somebody? You know what I mean? Find out what your limitations are. Don't just succumb to what your body is telling you. And also, so I think oftentimes we say, like, my depression. It's this time of month for my headache. No, it's not yours. Don't claim that stuff. Don't claim it because it doesn't define who you are. We have to continue to push through that curveball and make sure that we don't stay down. All right. So no more pretending. No more pretending. It's okay to be open and honest and to be out front with how you're feeling and what's going on in your life. Because the enemy oftentimes tries to make us keep things, suffer in silence and keep things to ourselves. It's like, no, speak that stuff out. And, and let's work together to make sure that you can get beyond that. And I also want to acknowledge that I understand that when life throws you a curveball, it's not always about a physical ailment. It's not always because, I've been diagnosed with cancer, I've been diagnosed with lupus, or I live with headaches. It's not always that. Sometimes life throws you a curveball, and I just want to acknowledge this because I feel like there's people out there, somebody came in your room late at night. That's a curveball. And I want you to know it's not only just ailments. We understand that you're traumatized and you've been traumatized because life threw you a curveball because somebody you trusted violated you. And I want to put that out there, and I want to say that does not define you. That act does not define you. That is not who you are. And you can also heal and move beyond that. Yes. Yeah. So I felt the need to say that because I want you to know that you have life and you can live a good life, although you were traumatized and you're dealing with that experience. So in saying that, I also just want to acknowledge that for those who have lost hope, whatever the situation might be, what would you say to a person who feel as though life is not worth living because of the circumstances?
This is deep. I don't been that person where, I've been on by hanging on by a string, but it's just my faith in this learning that it's okay to not be okay. Like you say, being a strong person and having to with a family. I'm always the tough one in my family, and like I say, my traumatic experience, like you're speaking on that, that's what I dealt with was military sexual trauma. So that right there, like you said, doesn't define. It's a trigger. It doesn't define you, but by speaking on that. But you know what, you have to just keep going. And if you can't, surround yourself with friends and family and speak. Don't hold it in and speak to someone, because like she said, that's what the enemy wants, to isolate you and keep you in silence. So, and then that way, all those thoughts in your head, speak to someone. You know what, I tell someone, I was thinking crazy. I don't know what I've been crying over, or I'm down. Find someone that can fight it. Like you say, go to a counselor. If you need to take medication, take medication. Scriptures, Bible, mindfulness. There's so many things. But first of all, just if you're want to harm yourself, number one, call 911 or seek out some medical attention. But tell someone, speak out. Because those issues try to take your voice from you, try to take your power. So right today, it's like, claiming your power, getting your power back.
Yeah.
Get your power back. Just hang on. Like I say, Dr. Dotson and all these beautiful ladies in here, and your family and friends, you are loved, you are wanted, and you are needed.
Thank you.
That's good.
All right. So Tamika, when we were at our event last week, you talked about a host of things. There were some nuggets for me that help change my mindset and help me to live happier. So can you share some of those things? And I'm sorry. One of the things you said it's important to have a healthy mind and a healthy body. That's really important to do. And then you gave us some nuggets to coincide with that.
And that's whatever healthy looks like for you. Because everybody in here has a different diagnosis of some sort, whether it's a physical, a mental, everybody has something going on. And I actually had that already wrote down. It's okay to not be okay. And acknowledge that. Look at how much, I don't like to say what you've gone through, but look at how much you've grown through. A lot of people won't ever even be able to handle a piece of what you've done. So it's okay to wake up and say, I'm not okay today. And that's healthy. To say I'm not okay. What's not healthy is to continue to just avoid everything, and then you are it's trauma after trauma, trigger after trigger all day long, because you're not taking care of you mentally. You have to take care of you mentally. And sometimes you can't take care of you physically. So it's okay to get some rest. Okay. But you don't want to rest too much to the point that it becomes depression. Because sometimes, and I've been there before, I was at a point in life where all I did was work, and then I wanted to sleep. I didn't want to take care of my kids. I did, but I didn't want to. I wanted to sleep because I didn't have to deal with it. So it was easy to say I'm tired versus dealing with what was really going on. So taking care of yourself, getting your rest, and figuring out what you like to do. For years, I didn't know what I like to do. I mean, I managed, I functioned like a robot. Daily, I did what I was supposed to do, and that was it. But I never knew what I liked to do. So take some time to yourself so that you can figure out what it is that you like to do. Take care of you. And once you do what you like to do, you'll find your joy. And of course, pray through it. I prayed out of that depression. Okay. And I did go to therapy too. Okay. So I had church and I had a therapist every Monday at 3:00 to figure out what was going on, because sometimes I'll be okay. And then 2 weeks later, I'm not. So it was like, how did I get back here when for the last 2 weeks I was doing so well? Because it's a lot of stuff that we avoid, a lot of things that we avoid, and we're not even realizing it, or we're not taking care of it in real time. So it comes up in later. So take care of yourself. Get your rest. Eat right, eat healthy. And that's what I talked about last week. And I said, you don't do a complete 360 in one day. Okay. So in moderation, make those changes that you need to make in order to be your best self. And that's whatever your best self is. Everybody in here has a different best self, because nobody here is the same. We're all very similar, but everybody's very different as well. That was about it.
Something I remember you saying something about we need to take 30 minutes of something and 20 minutes of something.
30 minutes of activity. So whether that's exercise, whether it's stretching, whether it's yoga, whatever that is for you. And then 20 minutes of silence. And that silence is just to gather your thoughts. Okay. Sometimes when they say you woke up on the wrong side of the bed, you didn't have the time to gather your thoughts. You jumped up late from your alarm, or you didn't take that time. But in 24 hours, you have 50 minutes for you. You have 30 minutes of activity and 20 minutes of silence. So take that time. And that 20 minutes of silence isn't during sleep. That's actually, taking in what's going on or preparing yourself for the day.
Wow. Thank you. That is really good. And so our mind is really important, just as much as our body is. We got to get our mind in check as well. So as we continue to heal, as we continue to get better, continue to get stronger, we have to also make sure that our mind is in the right place as well. It's been a joy being around these strong women in this room. What else? Is there anything else that you all want to share?
This is just wonderful. This is great advice. And, like you say, reach out if, you need somebody to help. Dr. Dotson, she has his number here. She can get you in contact with some people. But it's just wonderful to have this type of space, the safe space where we can come and have this conversation about, so much in our communities. Like, we don't want people to know if we have a disease, or, we don't want, like I say, what goes on in house stays in house. Don't tell nobody what's my business. So by, coming forward and showing, like, this is what, your diagnosis stage, how you look, you wouldn't even know that you had anything just going on with you. And same thing, look at you healthy and glowing. So just testimonies of God's goodness and his grace and his mercy and his healing power.
Thank you for that. And y'all just keep going on. I mean, despite the things that have happened, you all keep pushing on. So if there was one final thing that you would say in terms of like how you stay strong, how you continue going on, even in the midst of the struggles and the heaviness that sometimes we carry.
It's my kids and my grandkids. I use them for, they help give me strength and encouragement.
I guess I draw strength from a lot of things. I would say, of course, the Lord. Prayer, that's like number one. But like my mom, my kids, my friends, and my family. Like when I was going through, I tell y'all, friends, family, my mom, and my kids, they held me down. So that's one of the things that. Not one. That's the things that keep me pushing on and moving on and keeping strong. Oh, the other thing I wanted to say is for those that, that might be losing hope or have lost hope, don't give up. Don't give in. I know it might be hard, but you gotta realize that the things that you go through, it might be for you, but it might not be for you. It might be for you to be able to help somebody else through. That's one of the things that really stuck with me when I was going through, and it was really hard. That it might not have necessarily been something that I needed to learn, but for me to be able to go through it and to help somebody else go through their struggle. Don't give up. Don't give in.
Wow.
Stay strong.
To hear you say that and to know that, I mean, last year you didn't even know if you would be here this year. And just the experience of a bone marrow transplant. Did you say you had
Yes.
having a bone marrow transplant? I mean, my mind can barely even take in all of what that might have consisted of. And for you to say sometimes God does it for you, but sometimes he does it for others, to have that type of mindset. Thank you.
Welcome.
Chanel.
Tamika first.
Oh, okay. What was the question?
Hope.
Oh,
Somebody.
what do my prayer life? I pray a lot, a whole lot. You just have to, especially not only just with what you go through in life, but you encounter all types of different people and spirits on a daily basis. So you have to pray. And that's just what I do. That's the thing that helped me. I prayed up out of it. I mean that.
Wow.
Friends and family. Some of the family I chose to be my family. They weren't definitely, they're not blood family, but they're my family. I have really good friends that I've had since middle school, and the others I've had since high school. And they're my rock most of the time. And my kids, of course. And then I'm putting my nieces in there with my kids because they're all my kids and my babies. Gosh, and I pray a lot too. I've learned to pray a lot. I'm gonna say back in the day, I didn't so much. I was upset with the Lord because I didn't understand why He put me through all this. but I overcame that.
Wow.
I know I have a reason. I have a purpose to be here, even if it's just to be that the aunt to my nieces and the mother to my kids. I have a purpose.
You definitely have a purpose. You definitely have a purpose. And we got a seat for you at Church Without Walls when Pastor Powell's online too. So. We definitely got one.
Wants to be there too.
Right. But we definitely got one at Church Without Walls. So y'all, next Wednesday, I believe is Chanel's 53rd birthday. I told them y'all, they getting old up in here. They're getting old. Wow. Yes.
Oh, y'all reverse your numbers now?
Reverse the numbers. Okay. Once you get to a certain age, you reverse the numbers.
But you know what? I take that back. I'm proud because God bless us get something.
Oh, yeah. Because
Amen. So true.
I still got to get there.
So
I'm gonna get there.
You gonna get where?
Y'all got time to get there.
You know what? Y'all ain't even have to say that. You and Tamika y'all ain't even in this conversation right here.
I'm happy to be that age that some people don't get to make. And she said she's gonna make it to that age.
Oh yeah.
Yeah. And beyond, just say you're gonna make it to 70. Just leave out the, leave. Yeah, you're gonna make it to 70. You're gonna make it to 80. Let's go there, okay? So yeah. Exactly. So the topic today was, when life throws you a curveball, you don't stay down. You get up. You get up. So sometimes we might get knocked down for a variety of reasons, but please don't give up and never think that you're in it by yourself. That's another trick of the enemy of your mind, to make you think that you in something by yourself, that everybody is looking at you, that you got to be embarrassed about your circumstance. But listen, I can say that there are people who love you, who support you, who want to see you win, and I got four witnesses right in this room with me. Well, I'll say 5 if we count George. 5. So this has been a great conversation, but the purpose of the conversation was to help you to be your best self, was to help you to know that you are not alone in any circumstance and that you can make it. You can make it. So thank you to everyone who came out today. Happy birthday, Chanel.
Thank you.
Happy birthday.
Thank you.
And we will close out with saying, listen, y'all, Tamika got a bomb. Wait, I want to say Soaring
CNA Training Center.
Yes. And when I tell you she's putting those young people out, getting their stuff, getting their degrees and things and their certificates so that they can be lined up to do what they need to do, she's doing it.
Thank
You want to get them information on?
So we offer multiple different medical trades. So CNA, medical assistant, phlebotomy, EKG tech, medical billing and coding, and we have a new one coming up in a few weeks. So anything entry level healthcare positions that are good paying. So we offer all of those. I'm located right on Linden Road, Linden and Lennon, and it's at Soaring CNA Training Center.
And this is her business, y'all. She is the boss. She's the boss. Yes. Yes. So yes, don't get sidetracked. She pressed through some stuff. And look, she's doing a doggone thing. So yes. And Syveeta got
Rolling with You. It's a personal assistant business. I don't have I don't have Facebook, but you can find me on Facebook, Syveeta Powell. And I can be reached at 470-609-5703 if you want to get information about my business.
Look at that. Dang. You done started a business. How you do that in a year, man? Last year, this time, it was like not looking good.
My people.
Yes, that's what I'm talking
about.
Y'all, let's give it up. Let's give it up. This girl living. She said, I'm living my best life. Shoot.
I am.
Devil, you couldn't take me. You didn't take me. The Lord had me, and I'm going forward.
Yeah, I got me.
Yes. All right. So, Dr. Latressa, anything that we need to know regarding what you're doing?
No, I have 2 books out. Like I'm an author, so I do have a community book out, and also my book. One book is called "Pray But Don't Delay." Is MST, military sexual trauma. So I do have a book, self-help book out on that as well. It's on Amazon.
All right, and you're supposed to be coming to the church. We tried to do it.
We're gonna coordinate with the staff to come to the church.
All right, to do.
I would do education, blood pressure checks, and education.
All right. Let's put it out there. Somebody might want you to come.
Oh yeah,
come to their space.
Also work with Nurse T when we come out and we bring education to send the information. Do blood pressure training. Actually, I don't have it on my calendar, but this Friday, tomorrow we'll be doing a hands-on CPR with the deltas they're putting on canned goods.
Oh, I saw that.
Yes. So
okay. All right. Thank you.
That's all we have.
And Chanel, you got anything you want to share before we close out for the evening? Chanel about to get more involved.
All of you.
We about to get her more involved. She about to be doing some things. All right, y'all. Well, thank you for tuning in this Thursday evening. We so appreciated you. Hopefully this conversation helped you in some type of way. If you know of someone who could benefit from this information, this conversation, these wonderful women, please share the video and tag some people in it. All right. Well, we will be back with you again in maybe a week, maybe 2 weeks, but we'll see you on another Thursday in just a little bit. All right, y'all. Let's peace out. Let's give them, hey.
You should have been an Indian.
Broadcast in the house.